Hi, What the Health Tech listeners. I'm your host this week, Justine Abson. This is the podcast where we tackle some of the trending topics, ideas and best practice in health and social care. This week, we're speaking to Rhiannon. Rhiannon is one of our marketing executives at Radar Healthcare and focuses on our partners and potential partners in the public sector. Outside of work, Rhiannon enjoys writing short stories and screenplays with her husband, one of which has won several awards. Has it? Amazing.
Yeah, I know. Can you believe it?
Over the years, she's tried her hand at singing, dancing, playing the piano, and has settled on creative writing for now. She spent the last year moving into her first home and has recently got married. Congratulations, Rhiannon.
Thank you.
So, Rhiannon, welcome to What the Health Tech.
Thanks, it's great to be here.
I'm excited to have you. So today we're going to talk a little bit about KPIs and why they're important within health and social care. So earlier this year, you launched a campaign called Let the Data Do the Talking. It focused on a series of content which went into detail about the importance of goals, objectives, why key performance indicators are crucial in determining success, especially when it comes to data. Mm-hmm. So can you give us a little bit of a brief overview around this?
Yeah, sure. So the purpose of the campaign was to show how, with software like ours, healthcare workers can easily collate, analyse and access data. So we know a lot of data is still collected manually in healthcare, but with the right systems in place, it doesn't always have to be as time consuming and it doesn't have to take as much effort. So hence the name, Let the Data Do the Talking. So I guess it's this idea that data can sound really complicated and out of reach, but we know it makes such a difference, yet why there's still so many challenges around it. So with the campaign, we really wanted to strip all of that back and show the purpose of data and what it means from a healthcare point of view.
Yeah, and I think that's really important, isn't it? I mean, often KPIs are something which are associated with revenue, with sales. I don't think people see them as a big marker of success in other areas. Yep. So what does make them that success within healthcare?
Yeah, interesting. I'd say most organisations won't just have one focus. So yes, they'll have their sales targets, but they'll also have KPIs across different departments. So HR might have one on employee engagement, customer support might have one on customer satisfaction. It's the same in healthcare, so KPIs are just quantifiable measures that are used to track progress and in turn can be used for decision making. So yeah, but I'd say the main marker of success in healthcare is to provide better patient outcomes, so keeping people safe through prevention, diagnosis, treatment, and so on. But I think the trouble that a lot of healthcare organisations have is that there are a lot of barriers in place, and sometimes they can be things that are out of their control. So, financial barriers, so we see it all the time, struggling for funding, especially the NHS, but also like geography, so where the healthcare organisation might be in the country or even the world. But yeah, there are obviously things that are in their control as well. So there are things that they can do, but the main marker of success, I'd say, for most healthcare workers is to provide the best possible outcome for the patient. Of course, there will be specifics around that. So, for example, a care home might look at reducing the amount of falls they have. Ambulances might look at reducing waiting times. And waiting times is a really big barrier that we see again and again. And because we know the longer a patient has to wait for treatment, the longer they have to wait for treatment, the likelihood of a poorer outcome, which obviously healthcare organisations really don't want. So I think the key is around how organisations can reduce those barriers of getting in the way of providing that better outcome, basically. So yeah.
And I think it's about understanding that barrier as well, isn't it? You can't take the barrier away if you don't know what the barrier is in the first place.
Yeah.
And to provide that positive outcome, you need to remove the barrier. So you have to understand what those barriers are. And I guess that's where things like objectives and goals and, knowing what you need to get out of it can then help remove that.
Yeah, definitely. And just on that, actually, I think the whole going back to the markers of success thing, I think already in my 9 months at Radar Healthcare, I can see that there's been a big shift in focus for healthcare. So I think there's been more of a focus on like treatment rather than preventative care. So I saw a stat actually which said that 5% of the NHS's annual budget was spent on treatment, and then the rest, so 95%, was on preventative care. So that's a huge difference, and that was from 2020. And even in that time, I feel like so much has changed. Like 2 years, you can already see big focuses on preventative care. So population health, for example, I think that's all about preventative health care, isn't it? Because it's about the wider factors. So things like employment, education, things like that, in and amongst wider populations. So it's not just like one area. So yeah, so much has changed already in that time, and I guess that's the beauty of healthcare, that it is constantly evolving.
Yeah, I think it's, we've seen it this year as well with the introduction of things like learning from patient safety events. The new PISA framework has been released. I think there's a lot of emphasis on that patient safety side of things, which I think then comes into that preventative side, I guess, as well.
Yeah, definitely.
So what advice would you give to anyone looking for determining their KPIs? Where's a good place to start for someone that hasn't maybe looked at key performance indicators initially?
Yeah, I like to use the New Year's resolution example, and I guess that's because for me, from a personal kind of perspective, I don't set myself New Year's resolution, or at least I haven't for years, because I know I've never stuck to them. I feel like the goals that I have set have always been very short term. So whether that be like, January comes around after Christmas and you're like, yeah, I want to lose weight, or I want to lose so much in like 4 months. You give yourself like a unrealistic time frame. So I like to use the New Year's resolution because I feel like, everyone can relate back to that. I feel like people always set themselves up to kind of fail, and then they feel disappointed that they've not achieved it, and then it kind of like sparks that unproductive cycle of not kind of achieving their goals. So with KPIs, I think I go back to that, and I think treat your KPIs like you would your own personal goals. So does it align to your values? And we do have a blog on this on our website actually, but just to give like a basic outline, we've got 4 steps. So one is, which we've already discussed, what's the desired outcome? And for healthcare organisations, as we've said, a lot of that is to have that best kind of patient outcome. So thinking, does it align to that? 2 is, do your KPIs align to the organisation's values and what they deem important? And if they do, chances are your staff and your team are going to kind of stick to it. And 3 is, are they realistic? So, there's no point setting something that you're not going to be able to achieve in a certain time frame. And does it fit into your day-to-day? So we use SMART objectives a lot in marketing, and that's all around, is it realistic? And then lastly is, I like to use the 5 W's, so the who, what, when, why and where. So who are your stakeholders and who's going to action your KPIs?
Yeah, I think that's really interesting, and I think a lot of the, especially the W's is such almost an easy way to come back to what the goal is. We've talked loads in previous podcasts about the why, why you're doing something, and I think it could that could work for anything, and particularly here, I think it helps to kind of keep that focus, which is obviously a key thing. So we talk a lot about data, but what does it really mean? I think there's people probably listening to this going, it's data, what do we mean by data? A lot of people think numbers, but there's so many more ways to use that information as really good insight and knowledge. So how can healthcare providers make sure they know what they're doing or make sure they know they're doing this in the best way possible?
Yeah, I think, like you say, data is used probably so much in healthcare that the meaning behind it gets so lost. But But essentially, data is just basically things that we assume to be facts that are collected. So numbers, yes, but also like observations and findings, which then can be further interpreted. So there's quantitative and qualitative data, and healthcare organisations will have both. But I think the difficulty in quantitative data is that it's kind of lacking the context. So quantitative is the how much, the how often of something. And that's where you say the numbers and that kind of thing, where the context isn't really there. And I think that's where a lot of organisations will fall down, is because they're lacking that context and the why. But I'd say for healthcare organisations to get the most out of data, they just need to go back to the basics and try to remove those barriers to achieving that end goal. So if they can't do anything about their financial or their geographic circumstances, what can they change and review? What systems and processes do they have in place so that they can look at changing? And just because something's there obviously doesn't mean it works. I like to use technology as an example. So a lot of our partners have a goal of moving from paper to digital because of the barriers of keeping everything separate on paper. And moving to a completely digital solution has so many benefits, from reducing admin times, security, and having like one source of truth. So yeah, that's just one example of what can be done with data and the benefits of looking at systems and what you're doing with data.
I think in that sense as well, talking about the manual side of it, I think we touched on it a little bit earlier as well. It's almost impossible to analyse that data in an insightful way, if you like, because you might have, are you tracking the number of falls? Okay, that's great, but what does that actually mean, and what can you put in place to prevent that? Is it because somebody hasn't drank enough that day, they're dehydrated, has that impacted the fall? If you don't know those elements of something, then you can't ever put anything in place to stop that happening, and therefore, it stops that outcome that you want of providing the highest quality of care or the patient safety side of things. So I think these solutions are there to help you kind of bring all of that data together and help you analyse it in the best way possible as well.
Yeah, definitely. I think there's so much that can be done with data as well that, maybe healthcare organisations just aren't thinking about it. Maybe they're thinking that data is, completely, as I've said, like out of their reach and just too complex, when, there's systems out there that really help.
Yeah, I think, so data culture is a term which I know is heard a lot in our industry. So how do health and social care organisations go about creating a strong data culture themselves, especially if they don't really know where to start?
I'd say with data culture, I think it's really important. I'd say it's probably the most important part of data collection, because systems and processes don't just work on their own, or at least they don't in healthcare. Healthcare workers are having to report and record incidents and events that are happening, and sometimes they're really serious things that are impacting patients, good and bad. But it's important that they record these things and that the information is right. I think probably one of the problems that we tend to see is that people see data as a source of power. So they hold on to it, which is, ineffective. There's that well-known quote, knowledge is power. Well, yeah, it might be in some circumstances, but in healthcare, actually, it's really counterproductive. If you're not sharing the information and you're not sharing that data, then who's going to benefit from that? And it's not going to be the end patient, that's for sure.
It's the irony of it, isn't it? The irony is that actually data is so powerful when shared, whether it's sharing it with different departments, different people within the organisation, if you multi-site, different sites, it's to share that best practice and that knowledge of the data that you can learn from is incredibly powerful, because you could impact patient or resident safety at another location. And actually keeping it to yourself isn't powerful. It's not a thing, but actually I think that there still is that misconception that is there.
Yeah, absolutely. And one thing I was going to mention was I think it's Watkins actually breaks data culture down into 3 areas, which is kind of what you've touched on, which is the value that people place on data, the literacy around analytics in the organisation, and as you've said with the location thing, how well analytics reaches across the organisation. So that, like you say, if an organisation has different locations, departments and stuff, that becomes even more important because they need to get it right, not just in one place but in multiple places. And there's so much value that can be had with it, I think. And there's actually about, I think it's 10,000 data and analyst professions in the NHS and like public bodies. So that's a lot of roles, and there's more in primary care and other areas. So although there will be people that place value on data, it doesn't mean it's the same across the rest of the organisation. So I think it's about understanding the why and taking people along the ride and the story of the organisation. So, everything can be shared and there's that data culture and that engagement across the whole organisation.
Yeah, you very briefly mentioned as part of that about analysis, and I think, analysing your data that's the bit that can make a real difference to an organisation and create that better outcome as a result of it. But it does also go back to what we discussed at the beginning about an understanding of what an organisation wants to achieve with their KPIs. So what should our listeners consider when looking at a successful data management process?
Yeah, I think data management and data culture will need to go hand in hand. So consider this, you're a big organisation, you have multiple staff, locations, departments even. Chances are your data is probably going to be all over the place, or you might be using Excel spreadsheets and paper still and things that aren't traceable. And because your staff are most likely needing to access data quite quickly, and you want to make sure that things are picked up in someone's absence perhaps, then everything will need to be centralised, and that's where a data management system will come in and will help. So it makes sure that everyone's reading off the same hymn sheet. And one of our partners has done this really well actually. So they've seen like instant positives from bringing all of their data together, and the feedback that they got was really good from making like their data accessible for different people across the organisation, so not just certain staff members, and because they spent basically before using our system, they were spending time locating the information and they weren't actually looking at the data, they were just spending time trying to find it. So that in itself just shows how things can change when you've got the right systems in place.
Yeah, sometimes I think it's about actually we've got a report to do.
Yeah.
Let's put in what we need to put in to sort of achieve the objective of that report. But actually, the objective should be, but what does this mean?
Yeah.
How do we stop it? How do we prevent it? And I think that's that bit where there's something like that, even that kind of involvement is actually kind of really important for the future, really.
Yeah, and we're probably all guilty of it, aren't we? With things that we have to do for our jobs that we don't necessarily maybe know why we're doing it or understand, and like you say, you spend that time collating everything together, but then you don't actually know the true value of it kind of after you've done it maybe. So yeah.
And that again, you mentioned about the true value there, coming back to people feeling valued and that workplace culture, and there's so many things that actually sort of feed into this a little bit.
Yeah.
People feeling valued, they're reporting an incident, for example, but then what happens to that? Getting that feedback of what happened on the back of that makes them feel valued in terms of actually yes, that was the right thing to do. Yeah. Actually, this is what's now happening on the back of that. This has now stopped X happening. Yeah, whatever that might be. I think there's lots of little bits like that all feed into it to kind of come back to almost that joined up approach, if you like.
Yeah.
You know, I don't think people instantly think how data could impact a workplace culture, but actually this is where it can.
Yeah, definitely. Yeah, I think you're right. You're bang on there.
So going back to setting goals and objectives, what should our listeners do to make sure that they don't lose sight of that? I guess it's going back to that why and understanding that, you know, how do they remember what they're setting out to achieve in the first place?
Yeah, it's funny that you say that actually, because I think one of our customer success managers was sat in this exact chair doing, I think it was a partnership podcast, and I think he said a similar thing, that our partners kind of lost sight of their KPIs in amongst their day-to-day roles. So I think it is really difficult. That's the hard part, isn't it? It's really difficult, but just going back to that, telling the story and having the right systems and processes in place to make things as easy as possible, to remove those barriers so that you can make it as easy as possible for your staff basically to access that information. Because as we said, data culture is all about, you know, bringing people together so they understand. You know, if it's not your role and you're not doing it day in, day out, you're not going to understand it. So yeah, it's all about that story and showing that everyone in the business, well, the organisation has a purpose and they're there to make a difference. So yeah.
It's that communication side as well, isn't it? You know, it's, I think the podcast that you're referring to, I think it was said in that, you know, often the person that's making the decision or the purchase of something like a data management system, for example, they're not the ones using it day to day. They're not the ones that are actually focusing on how it implements, how, you know, all of those kind of areas. And actually communicating what the original objective is of why they're getting this, filtering that down to everybody who is then using it and how that is going to impact their day to day. Yeah, that's fundamental, really. You know, if people can understand why it's going to help or how it's going to help, and why they've done it in the first place, then it's a much better place to be, I think. Yeah. In terms of how you can make a difference, and it's about working together, I think.
Definitely. Yeah.
So, Rhiannon, at the end of every episode, we like to ask about what the health tech moment. It's a bit of fun, it's weird and wonderful stories from people that work within health and social care. You know, we've had lots of different variations of these. So, what's your what the health tech moment?
Oh, okay. So, I think I've got one. I used to work at a prosthetics company.
Oh, wow.
So, yeah, before working at Radar Healthcare, and we did kind of, you know, we saw patients and we did like case studies and stuff. And there was this one time where we had a lady who was a patient who we were going down to London to film her, and she was going to do water skiing. And wow. she wore a prosthetic leg and everything. And she did triathlons and all sorts. And yeah, I was travelling down, and I just happened to be in the car with her travelling to where we were going. And she was just explaining to me what had happened to her and how she'd had this tragic accident, which was in a car. And she basically, she lost her foot. And now she's wearing a prosthetic leg, and she's driving to this water skiing place, and she's gonna, you know, do water skiing. And I was just sat in the passenger seat thinking, oh my God, how is she doing this? You know, like, she's basically, you know, she's overcome probably a fear that she might have had before. And it was just so inspiring. I think she said something like, I do this for my son. Which was just amazing. I think after that, I was like, you know, people really can get through anything. So yeah, it was a really special moment.
Oh, that's a really lovely, a lovely story about that. And I think that, you know, that again, that's just another side of healthcare that people don't always think about. There's so much involved. It's incredible. So yeah, what a lovely what the health tech moment. So thank you for joining us this week, Rhiannon, and thank you to everybody else for listening. Join us next Thursday for another new episode of What the Health Tech. And don't forget to rate and subscribe wherever you get your podcasts. And if you have any questions for us or our guests, please email whatthehealthtech@radarhealthcare.com.